Your body thinks in feels, and it has so many different ways that it feels. We have exteroception, sensory input coming in through our outer senses. We have proprioception, our body's sense of itself in terms of movement and in stillness, but we also have an even more subtle sensing system known as interoception. This is our body's ability to physiologically listen to itself and to gather signals that come from hundreds of millions of free nerve endings, as well as nerve endings coming from your viscera, from your vagus, that gather into your brain in a spinal pathway called the lateral thalamic pathway and terminating at the insula. Thanks to the great work of Bud Craig, we know a lot about interoception. Interoception is what lets you know you're thirsty. It's what lets you feel food moving through your guts. It's also how you determine pain and temperature. There are so many different aspects to interoception, but for some people, interoception is very cut off. It's very removed. They can't actually sense things like their heartbeat or their breath's movement in their body. So I'm going to share with you just a few techniques that are helpful as amplifiers of this physiological listening system. First, we'll just start on our back, just as a little test, a little check-in. You come onto your back, close your eyes, and even noticing that in the recline, if there is a sense of shift in your body's demeanor, even in its emotional sense of things, because gravity changes pressures all over the body. And often within seconds of reclining, you might have this involuntary sigh or this off-gassing that comes out of your body due to the change in your heart rate and your relationship to gravity. And sensing that is through your interoceptive pathways. Then begin to concentrate on how your body is choosing to breathe. You don't need to make breathing happen. In fact, when you start to pay attention to breathing, often it can become very self-conscious, but pretend that it's not self-conscious and just watch your body breathe if you're able to. See air move in and see and feel air move out. The movement of air is one of those interoceptive results. It's one of those interoceptive self-analysis. Next, connect your index and thumb finger together on each hand into the OK symbol. And now instead of staring at your breathing, turn your inner stare at your pulse and notice if you can feel it in your fingertips. The sense of one's own heartbeat is also an interoceptive feature. Now, if that seems vague or undecipherable, we can go even more directly to try to feel the heart. And so our next little check-in is to use a Coregeous ball, or you can use a rolled up yoga mat or even a rolled up blanket or pillow, and place it right there at your sternum like a conch shell. Having pressure on the sternum, and your heart is right behind the sternum, might help you to feel the lub-dub of your heart. So you rest here and notice if you start to feel the beating inside your chest. And you might even feel the beating echo into the air-filled chamber of the ball. Now keep honing in on that sense of your heart and then begin to expand the inhales that you're taking, so they're bigger inhales, and expand the duration of the exhales that you're taking. Breathe in a little bit longer and breathe out a little bit longer while still sensing the beating of your heart. So now we're compounding more and more interoceptive feedback into this. And then lastly, now that you have potentially amplified the sensation of your heartbeat and airflow, we'll go towards that vagal afferent. We'll go towards our interoception of our guts. So what you do here, this is called gut baby, is you bring the Coregeous ball or whatever object you have right to the side of your abdomen. Not to the side of the bones of your rib cage and pelvis, but you actually want to try to move the ball just to the side of your abdominal fat and support all your guts and the soft tissues and the muscles that are in front of your viscera. And literally, as soon as I did this, I started to hear some growling and bubbling. So in gut baby, what you do to help enhance this interoceptive feedback is you can take your top hand, which would be more like touch and proprioception, is try to help the contents of your abdomen spill out and over and rest upon the ball. You can be deliberate with your breath here, taking big breaths in and out, or you can just let your breath move as it will. And your task here is to just listen. I am listening. And so these are all ways of helping you to dial up the communication between your body and brain and your brain and body. It really is a two-way street. But depending upon hurdles that we might have experienced in our life developmentally or injuries that may have come into our bodies, it may have interrupted at a certain stage of development our own hookup between this physiological sensing and our ability to truly pick it up on its radar. There are also those individuals who have a heightened sense of interoception that is profoundly distracting. This is the case with people who have high levels of anxiety or are prone to panic attacks. They're feeling their heartbeat all the time, and it's an incredible distraction. So really, the sweet spot is being able to sense your body's needs and acting upon them in a safe and appropriate manner as they occur. And if you feel like you're on one or the other end of the spectrum, where you feel disconnected, disembodied from your body's signals, or whether there's too much noise constantly, you can seek out a somatically trained therapist who can really help you to calibrate and recalibrate your body sense so that you can really be in tune with the way your body thinks, feels.